2024 Haldeman Norfolk Health and Social Services Advisory Committee meeting to order. Are there any declarations or disclosures of pecuniary interest? Seeing none. The additions to the agenda. There was Dr. Locke would like to speak on the public health update, so that'll be added. Is there anything else? Anyone have anything else? If not, may I have a motion to approve the Haldeman Norfolk Health and Social Services Advisory Committee meeting minutes? Oh, sorry, my mistake. Just a motion that we accept the minutes as amended. Thank you, John. And I need a seconder. Patrick, thank you very much. All those in favor? That is carried. Thank you very much. Adoption committee meeting. So we'll move forward then. We're just waiting for the mayor. She should be here momentarily. Number 3, we'll go on to the adoption and corrections of advisory committee meeting minutes. May I have a motion to approve the Haldeman Norfolk Health and Social Services Advisory Committee minutes from June the 24th meeting? Can I have a mover, please? Councillor Duffy. Seconder, please. Thank you, John. With that, are there all in favor? Opposed? Carry. Is there anything coming out of those minutes? Do we have anything that wants to be discussed or anything like that?
Thank you, Madam Chair. Everything that was in the advisory committee went to Board of Health, and no further updates were provided.
Oh, thank you very much. Moving on then. Moving on to number 4, which is the update of reports. Sarah?
Madam Chair, my apologies, I jumped the gun. There is nothing further to report at this time. Thanks.
All right, moving on to number 5, 5.1, Public Health, 5.1.1, Healthy Babies, Healthy Children Program, and Funding Update. Reporting to introduce this is Syed.
Thank you, Madam Chair. Through you, I would like to introduce Nikki Laws, Program Manager for Healthy Growth and Development, to present this report. Thank you.
Good morning. Through the chair to the members of the Haldeman Norfolk Health and Social Services Advisory Committee, I'll be presenting HSS-24-041, Healthy Babies, Healthy Children Program Update and Funding Update. So just to briefly share what I will be discussing today, giving you an overview of ACES, our HBHC program, the HBHC 2023 stats, a funding update, and our funding proposal. So I know I'm here today to give you an update on our HBHC program, but I wanted to provide you with some information on adverse childhood experiences, or also known as ACEs, as the understanding what they are and how to prevent them are fundamental to the work we do with our HBHC program. So adverse childhood experiences, ACEs, as I'll refer to them, are traumatic events that occur in childhood, such as a child abuse, neglect, food insecurity, or household dysfunction. These experiences can significantly impact a child's social, emotional, physical well-being and the development, often leading to long-term health issues and behavioral challenges. Research around ACEs demonstrates the connection between early trauma and later life outcomes, emphasizing the importance of prevention and intervention to promote resilience and healing. As a child's brain develops, it's crucial to prevent trauma. The more trauma they have, those more traumatic events that they experience, the more damage to the child's developing brain. Long-term, this can present as, so long-term, this can present as risky behavior, mental illness, chronic disease, and substance use. Excuse me. If we look at risky behaviors, for example, people who have experienced ACEs may engage in risky behaviors for multiple reasons. So coping mechanism. Risky behaviors serve as a way to cope with emotional pain, trauma, stress. Engaging in these behaviors might help temporarily relieve those feelings and also offer a sense of control. It can lead to impaired decision-making. So it affects the brain development, particularly in areas around decision-making and impulse control, and it leads to increased impulsivity and difficulty weighing the consequences of actions. Desensitization. So experiencing trauma may lead to desensitizations of risk. Individuals might be accustomed to chaos and anger and danger, and making risky behaviors feel more normalized and less intimidating. There's social influences. So those with ACEs might find themselves in an environment or peer groups where they reinforce those risky behaviors, and that in turn it makes it harder for them to break the cycle or make better decisions. Low self-esteem. So ACEs affect their self-worth, and it leads to individuals reaching out and seeking validation and acceptance through risky behaviors, even though they know the risks involved. Mental health issues. So ACEs are linked to higher mental health conditions like anxiety, depression, PTSD, which can contribute to engaging in risky behaviors as a form of self-medication or escape. When we look at chronic disease, that's one we see obviously in our population. So people that experience trauma may be at greater risk of those health challenges later on in life. When a child's brain is developing, trauma can affect the way their cells divide and replicate, which can lead to cancer as a child or later on in life. In addition, it can affect the way our heart functions, leading to high blood pressure, which results in hypertension and heart disease. The cost of ACEs in North America is around $745 billion. In Ontario and Halton and Norfolk specifically, we don't have a lot of data that speaks to the cost and impact of ACEs, but that's something that we're going to be looking at addressing and getting more capacity to track with our community partners. So by equipping our nurses and ultimately our community with the knowledge around prevention and mitigation of ACEs, we can improve the overall health and decrease the overall impact of the economic burden of ACEs. So moving over to our program, Healthy Babies, Healthy Children. So it's designed to help children in Ontario have a healthy start in life, provide them with opportunities so that they can reach their full potential. It began in 1998 and is mandated by the Ontario Public Health Standards and funded by the Ministry of Children, Community and Social Services. We deliver this through our HBHC team, which consists of one program assistant, 4.5 public health nurses, and family home visitors. Our program works by providing effective upstream interventions on building stronger families and stronger, more connected communities. In our program, we address systemic and structural determinants of health and try to improve health equity for our clients. Our team delivers HBHC in collaboration with community partners like the Norfolk General Hospital, other parenting groups and family supports like REACH, as well as Child and Protective Services of Grand Erie. There's a lot of research that speaks to the impact and the effectiveness of our program. The Chief Medical Officer's 2023 annual report spoke to HBHC as an effective and promising substance use intervention through its ability to build stronger families and communities. So as in the report I've provided you today, I have our program-related data. So just to note, what you see up on the screen is slightly different than what's in your report because the report has the most up-to-date data as of last week. So in 2023, 1,060 children were born in Halton and Norfolk. Of those that born, we received 993 screens. From here, 775 families were identified with risk, which means 2 or more yeses on our ministry-developed universal screening tool. My team was able to contact 623 of those families and offer a home visit. 145 families received home visit and an in-depth assessment. An in-depth assessment is just that. It's more in-depth, asks many questions from their family history, parenting strategies, mental health, relationships, etc. So you may be wondering why there's such a big gap between that 775 all the way down to 145 families. So the ministry tool is a great tool for screening universally. It captures more people at risk than can be found with focused screenings or assessments. So it's better to be more cautious, capture more people, and then try to streamline and figure out who those are at greatest need. Once we connect with these families, we find out that they may be involved with midwifery or other healthcare providers and don't need our services. Sometimes they have had a C-section in a large baby, and that can identify them as risk. They may have a history of anxiety, but now have supports in place, or we're having issues with breastfeeding at the bedside, but since coming home, we have great lactation consultant support, so they've been supported at home, and so they no longer need our programs. And then at the end of the day, it's voluntary, so even if there's red flags and they're at risk, they can still say no to us to work with our program. After completing the IDA, 96 families were identified with risk and confirmed identification of risk, and they consented to receiving care with my team. Throughout 2023, our team interacted with families 4,343 times, and in total supported 623 families. These interactions were anywhere from home visiting to providing resources and connecting with community supports. Even if a client doesn't meet the criteria for our program, our nurses ensure that they're set up for success and best possible outcomes by becoming aware of the resources and supports in our community. We also have nurses dedicated that go into Norfolk General Hospital and provide that bedside support, and this accounts for 185 additional interactions. In addition to the work our programs do with our clients, there is a lot of things going on in the background with training. They have to do annual training every year, and we're also working with internal and external community support or community committees to make sure we are meeting the clients and the community partners where they need it. While the numbers highlight the quantitative impact of our program, it's the feedback from families with positive outcomes that experience that truly showcase the value of our program. The 3 success letters included in your package are just a glimpse of the wonderful testimonials received from our clients. So we were recently notified that for the first time since 2015, the Ministry of Children, Community and Social Services has provided us with a funding increase of $60,754. We are hoping to use this funding to hire a 0.5 FTE public health nurse. So why do we need this 0.5 FTPHN? So the growing population and evolving health needs in our community are well known, and they've prompted many of our community partners to expand their services. Norfolk General Hospital has recently hired 2 new full-time OBs and has 1 full-time OB and will be having 2 more starting in the next few months. Our family health teams in Haldeman and Norfolk have enhanced the services available in their perinatal care clinics. And so us, like the community partners, we also need to step up to meet the increasing needs of our community and our clients and ensure everyone receives the care that they need. Other reasons include families who have had babies, especially those in our greater city hospitals in Hamilton, Woodstock, et cetera. They are discharging clients because of the shortage of nurses and beds. They're discharging their clients at 24 hours. So clients are coming home with more needs. And those first 3 days after a baby's born, those are the most crucial, with breastfeeding and supporting maternal mental health. So that's where our nurses are supporting more closely. Norfolk County has lost its only full-time pediatrician, and Haldeman doesn't have one. And with just a few walk-in clinics available and a shortage of family doctors, we are seeing a lot of clients that either don't have a family doctor or can't get timely care to support the needs. And when we talk about babies, time is of the essence. So my nurses are there, to support. Over 60% of our clients are dealing with mental health concerns, and that takes an extended amount of support for my staff. These challenges significantly impact the health of our clients and our families. And to meet these health needs, particularly those in mental health, we have a lot of work that we have planned ahead. We aim to adopt a more productive approach and proactive approach and framework to better respond to and prevent adverse childhood experiences. The additional 0.5 FTE will be dedicated to leading efforts on adverse childhood experiences, both within HNHU and with the greater community. The role will encompass training on brain development and ACEs prevention. They will participate in the provincial ACEs community of practice to ensure our approach aligns with efforts across the province. Additionally, they will support team members with evidence-based strategies to mitigate the negative impacts of impaired parenting practices, postpartum depression, and other maternal health concerns, which are significantly contributors to ACEs. This includes working to reduce the negative health impacts our clients face due to the social determinants of health barriers. We'll also focus on strengthening our relationship with Indigenous partners and our low German community population. If we think back to the stats, even if my team were to support 50% of those families that are with risk, they would be drowning. There wouldn't be the capacity. So we are trying to focus on those with most risk and also help the greater community to help mitigate the risks and the prevention of ACEs. The additional FTE will align with our team structure align our team structure with that of our future partner in public health, Brant County Health Unit. By aligning now, we aim to minimize the potential changes in service deliveries as well as in our staffing. So in summary, hiring an additional FTE will help my team address the needs of our communities, work more effectively, work that we continuously are challenged to keep up with. Given the priority of addressing ACEs, without the additional support, we risk being able to comprehensively mitigate their negative impacts on our communities. Thanks for your time, and I'm open to any questions.
Thank you very much for the report, and it's so important. I'm happy to see that you got this position and the funding for it. We certainly need several more positions as far as I'm concerned in the Healthy Babies, Healthy Children program. I know I see it utilized throughout our communities and really appreciate that service for sure. So happy to see this. Does anybody have any comments or questions? Councillor Metcalf?
Am I on? Oh yeah, red is. It's okay. A little bit of jet lag this morning, but that's okay. Through you, Madam Chair, excellent report, Nikki. Touched on a lot of information I wasn't aware of, and I think it's a great program. The ACES program is about healthy babies, healthy Head Start. We're much like the corporations. You know, they want to get at the lowest level people involved. And I think it's great that we're out there, we're in the public, they know about us, it's being utilized. That's the big thing. When I see those numbers about how many were the births and how many screenings, you know, you're looking at about 93%. And of course, not everybody's going to be at risk, but identifying the ultra at-risk people, I think that's very important. And I'm glad to see that we got extra funding for that to provide for another nurse. And just basically comments, not that I think it's a great program, and hope it continues and flourishes.
Thank you.
Anyone else? Councillor Vanershi?
Thank you very much. As well, a very good synopsis of what's going on. When we look at you visited in 23 over 4,000 visits. How many of those were not necessarily babies, but smaller children or younger children that you want to address issues that don't want to be prolonged or end up getting more severe? How many of those have you visited?
It's difficult. A lot of our families, we are involved with them through multiple children. So even if we are re-engaged with them from birth, or even shortly after birth, we still support the other children that are within the home. So we do see, I'm sorry, I could find out, but I don't have the exact number, but we do see frequently where we refer to them as an early identification. So after six weeks that we support, and we work with the school boards to do developmental screening and try and get ahead of potential problems later on. So yeah, we support obviously babies and new moms, but we do see, and my staff do work with older children as well.
Well, that's what I'm looking for, and I think that's the amazing part of it. Going in and seeing the babies, but yet there's a sibling there that could, you know, need some attention and or a different direction or a different resource or whatever. And it's wonderful to see that that's not neglected. It's not just the babies when you go in. It's what you take a wholesome approach and take a look at the whole family and see if there's things that can be addressed. So just moving forward then, I'd like to, Sarah, if you could describe to me then the budget amendment request. On the net levy, we have a negative of 50/50 here, 50,500. That's what I'm seeing because it's bracketed. It's a decrease of 50,000. See, it's written up as a former accountant. When you put brackets around something, that's going down. And I want to check to make sure that I'm
Thanks, Committee Member Vanershi. I'll pass it over to Michael for a further explanation.
Thank you for the question. Yeah, so that is just to reflect this current budget because the funding was announced and is prorated back to April 1st. So because the position won't be in place until midway through the year, that's just a decrease to the levy for this year. And then going forward, we will be almost a wash for the levy.
Going forward, it'll be almost a wash, then, is what you're telling me.
That's correct.
Okay, perfect. Thank you very much.
Is there any further comments or questions? Councillor Duthie?
Thank you, Madam Chair, and through you. So just a couple of quick questions. The position that you want to hire is it's a 0.5 FTE. I guess I'm just curious, and my apologies, I don't really understand. I shouldn't say understand. I don't really know that world that well. Will we be able to find a person that will take on that 0.5? And do you anticipate any challenges in staffing that?
Thank you. So through you, Madam Chair, to Councillor Duffy. So a 0.5 what I envision will be working part-time 2 to 3 days per week. And we have another 0.5 position that works well, and it provides that work-life balance that some nurses like. So I don't foresee any issues with hiring a 0.5.
Perfect. Thank you. And then I think you mentioned in the report, and I'm curious, maybe because I had missed something, but Norfolk doesn't have a full-time pediatrician any longer?
Yeah, we have one part-time pediatrician.
Really? Okay, thank you.
Thank you. Any further questions or comments? Seeing none, may I have a motion to accept the recommendations within the report, please? Councillor Van Riesche moved it, seconded. Oh, Councillor O'Neill, thank you. And all in favor? And that's carried. Thank you very much. We'll move on to 5.1.2, the Planet Youth Approach to Youth Substance Use Prevention, HSS-24-035. The Director of Public Health, Saeed Shahi, is going to present this report. Thank you.
Thank you. Through you, Madam Chair, I would like to introduce my colleagues Josh Daly and Lena Hassan to present this report. Over to you, Lena. Thank you.
Thank you. Good morning, Mayor, Council, committee members, and everybody else. My name is Lena Hassan, and my colleague is Josh Daly. We're both health promoters at the Haldeman Norfolk Health Unit. We are here today to introduce you to an evidence-based youth substance use prevention model called Planet Youth. Before we get into our discussion of Planet Youth, we would like to give a brief overview of what is known currently regarding youth substance use. It is important to remember that there is no single cause of problematic substance use among youth. The drivers of substance use are complex and include a mixture of biological, environmental, and social factors. Substance use is influenced by genetics, early life experiences, example, trauma, adverse childhood experiences or ACEs that Nikki just talked about, family history of mental health or substance use, as well as factors such as the marketing of psychoactive substances, their availability, family and peer relationships, and social determinants of health, such as stable housing and family income. The presence of risk and protective factors, which Josh will explain a little later on, can lead one towards or protect one from substance use. Research also shows that the earlier the age of initiation of the age of first substance use is associated with progression towards heavy substance use and increased risk of for substance use disorders later on. That is why much of the focus of public health is on delaying initiation and preventing harms from substance use. We also know that youth report a variety of reasons to explain why they use substances. Substance use is different for everyone and exists on a spectrum with varying stages of benefits and harms, where a person moves back and forth between the stages over time. Finally, we know that substance use is a complex issue requiring a complex solution. It requires investing upstream to ensure people have equitable access to social determinants of health and mental health supports, as well as strong social relationships and connections that can protect them from harmful substance use. Locally, based on the 2022 Community Needs Assessment, evidence showed that there was an uptick in substance use compared to pre-pandemic level. 17% of participants reported their alcohol use increased during the pandemic. 7% of participants reported their cannabis use increased during the pandemic. And finally, 7% of participants reported their tobacco use increased during the pandemic. Being a rural health unit with a small population, it is hard to come by local and timely data, so we rely on provincial data. So we'll now take a brief high-level look at what substance use looks like in Ontario. Based on the 2023 Ontario Student Drug Use and Health Survey, also known as OSDAS, the most commonly drugs used among students in grades 7 to 12 are alcohol, at 35.6%, prescription opioid pain relievers at 21.8%, cannabis at 17.6%, and vapes or electronic cigarettes at 13.4%. We also know that cannabis and alcohol use increases with grade level. So cannabis use ranges from 12% of students in grades 9 and 10, and it goes up to 34% by the 12th grade. Alcohol ranges from 8% of students in grade 7 and 8. It goes up to 30% in 9th and 10th, and finally 54% of students in the 12th grade. 10% of students in grades 7 to 12 also report binge drinking, which is defined as 5 or more drinks on one occasion at least once in the past month. Finally, about 1 in 8, 13% students in grades 7 to 12 report vaping in the past year. So when we look at early initiation of use, almost half or 47% of secondary school students who drank alcohol in the past year report that they first started to drink before grade 9. About 43% of high school students who vaped in the past year report that they first started to vape before grade 9. And then 29% of high school students who smoke tobacco cigarettes in the past year report they first started to smoke before grade 9. And then finally, 18% of high school students who use cannabis in the past year report that they first started to use cannabis before grade 9. So we would like to see these numbers go down. So the substance use team has been working hard to establish a local community drug and alcohol strategy for our region, which is an evidence-based and comprehensive approach to addressing substance use. The Lighthouse Community Strategy is structured around the 4 pillars of prevention, treatment, harm reduction, and community safety. We envision that Planet Youth will fit under the prevention pillar, where the focus is on interventions that seek to prevent or delay the onset of substance use and that address root causes of substance use. I will now pass to Josh to explain a bit more about the Planet Youth model.
All right, thank you. So now that you have a bit of a lay of the land for substance use across the province, I'm going to speak to what exactly the Icelandic prevention model or Planet Youth is, and what it could look like if we roll that out in our community. So the Icelandic prevention model, or IPM, it really is an upstream evidence-based approach. So it's right in alignment with other public health approaches, looking at preventing substance use in youth, but it also has been shown to have other positive outcomes, so beyond substance use to other domains of their life. A difference for this approach versus other ones is that it views society as the patient. So many traditional public health or health approaches tell young people, don't do this, it has this harm, it has this risk. Those have been shown to be minimally effective. Anyone that has young people in their lives knows you tell them no, it doesn't always pan out the way you hope it would, right? So what this does, it takes a more holistic approach, looks at their environment, their products of their environment. What are those things that increase the risk that they would use substances, or what are those protective factors that would shield or buffer them from becoming addicted or using substances in a problematic way. And this approach is really rooted in community action and collaboration. It's individual to each community. It looks at their strengths, their assets, what are the highest risks or the greatest protective factors that we can look at, and then come up with a plan that's really individualized for each community. So you might be asking, why Iceland? Iceland actually had the highest substance use rates all across Europe in the mid to late 90s. And some people there got together, they said, this is an issue, we need to address it. So they came up with this holistic kind of viewing society as the patient approach. And then over the next 15 years, you can see on the chart there, they had some substantial decreases in their substance use rates. And then equally as impressive, they were able to maintain and sustain those gains over the following 10 to 15 years, and currently is the same situation. So not surprisingly, countries and communities around the world took notice because substance use is something everyone is dealing with. And they're like, what's going on in Iceland? How can we kind of take that here or implement that here? And so that's what Planet Youth itself, it's a consultancy organization that packages and exports and supports communities to implement this approach in their own community. So one of the key aspects of this approach that's been referenced a couple times, it's looking at the risk and the protective factors in young people's lives. So these vary. There are a number of things that are kind of, I guess you would say, characteristics that either increase that risk that they would become users of substances, or those protective factors that sway them the other way. And it can be anything from, how much quality time they spend as a family, how engaged are they in school, are they involved in extracurriculars, do they have older substances or peer crowd, or older siblings or peers that are using substances, or the flip side of those coins. So if they don't have many boundaries or much supervision at home, that would be a risk factor in their life. Or if they're bored and they aren't engaged in anything, that's another risk factor. Or if they're not engaged in school. So you can see that it's a balance. We want to tip them more towards protective factors and mitigate some of those risk factors as a society. So how would the Icelandic prevention model actually be implemented in the community? It's community building 101. We're getting together all those key players that have some type of an interest or a role to play in young people's lives, and building a coalition. So that's everyone from rec departments, faith communities, school boards, service clubs, youth serving agencies, substance use community, the list goes on and on, law enforcement, bringing them all together, and then getting some local data from students that is timely. So there's a survey that would go out to high school students. Planet Youth analyzes that data, gives it back to us in 6 to 8 weeks, which is very quick turnaround for health data, which you heard from Lena. Usually we're dealing with a lag, so we're not looking at data that actually represents the students that are currently filling out those surveys. So this is a nice quick turnaround, and then we look at that data with our coalition, come up with a plan, and implement that plan in our community. So the actions that these coalitions would devise would look at the 4 main domains in a young person's life. So those include their leisure time, their home and family life, their peer group, and their school experience. So there are risk factors and protective factors in each of those domains, and the survey results would show you which ones are the highest or the lowest, and then that coalition would look at those results to come up with a plan. They would implement some interventions over the course of a year, 2 years, and then we would repeat, take a new survey, see if any of those trends have changed, and would we need to continue what we're doing, revise, select new intervention, et cetera. And it really is a long-term approach. It's not just a show up for one time with a presentation or an event and hope that that's going to make a difference. We're really taking a holistic, comprehensive view of the issue of substance use prevention. Earlier this year, in January, we applied as a health unit because the Public Health Agency of Canada was offering some grants to communities that were really starting from scratch with this approach, which is what we were. We were successful in getting that grant, which was exciting. The grant is designed for capacity building, community engagement, working with school boards to get them ready for that data collection, some of those really ground level, the first initial stages. So that is where we are. We were one of 7 sites across Canada that were selected out of 50 plus applicants. So that was a good news story. The grant was for $118,000 over 18 months from April 24 to August of 2025 to support those early steps, like I said. So some of those funds went toward funding for staffing for that initiative, as well as entering a service agreement with Planet Youth, because they do provide the support and the data analysis, project management, all of those pieces, and then just the community engagement parts. So Lena and I have been busy since we found out that we received that grant. We've been knocking on doors in the community at different tables and agencies and service clubs, trying to get the word out about the Planet Youth approach, to build up some support, and we've had some good support so far, and we're continuing to do that. We are hoping to develop this local coalition, like I talked about, out of a forum that we're going to have in November is the plan. We're hoping to have one in Dunnville and one in Simcoe to hopefully reach kind of the whole breadth of our community. And then out of that, we would have that coalition form and start the process of really moving forward with the substance use approach. That's Planet Youth in a nutshell. I'm happy to accept questions.
Thank you very much for your presentation, and I've been doing a little bit of research on this Icelandic model, and I'm happy to see that it's come to Haldeman Norfolk Health Unit, and you're going to be trying to implement that here. The only concern, I just have a few concerns, I guess, would be the funding for it to initialize. We're hopeful that that funding will continue so we can provide this service longer than the 18 months.
Yeah, so I should have failed to mention, I guess. So recipients for the Stream 1 funding, that first grant, they may be offered to apply for Stream 2 down the road in 2025, which would be a longer term, a 3-year funding of greater funds to actually support the implementation of interventions and data collection and kind of that cyclical approach. So we're optimistic that we will have that funding to continue this work on for sure.
Good news. And just one more thing. So you haven't really looked at stats for Haldeman Norfolk for our drug use population, or have you? Because in here it refers to Ontario.
Yeah, sorry. So
So,
yes,
go
Madam
ahead.
Chair, thank you. So it is hard to get youth drug use statistics that are, we don't oversample. So the results that come from the Ontario Student Drug Use Survey are not necessarily representative or specific to our location. So we rely mostly on that provincial level data, which is another benefit for this approach, is we would actually get regular, timely youth substance use data. Because we know there are differences for us versus other pockets of the province. So it'd be nice to really know what's happening currently in our youth
Right.
to address that. Yeah.
Okay, appreciate that. Thank you. Councillor Van Riesche had a question.
Thank you, Madam Chair, and through you. The idea of speaking with other departments within Norfolk and Haldeman, the Parks and Rec Department that came up at the meeting the other day, have you had conversations with them or are going to start conversations? Because we don't want to inundate the populations with more surveys. We want to be, kind of make it more specific so that they know what they're answering to. Because, you get overwhelmed with this and then you don't. So they were having a discussion about putting something in the high school. So I'm hoping that you would speak, or have you spoken with Parks and Rec?
Yep. Through you, Madam Chair, and to Committee Member Van Riesche, yes, we have spoken to Norfolk County Parks and Rec, to their director and their general.
When was that?
A couple weeks ago. So,
Oh, okay, she had no knowledge of that at the meeting last week, so I'm curious. She knew that there was some funding available, and she wondered if there was some sort of collaboration that can take place so that we can find out some more things about the youth. The youth right now there's a lot of kids that are in our organized sports, which is wonderful. We know where our kids are, you know what you're doing, that's great. It's for these kids that are looking for just a drop-in, something to do, to take their mind off, not to get involved in other things. So I'm wondering if you do have those discussions and can collaborate together, that would help as well with what kind of survey can go out to the high schools, because drop-in centers, I'm far from youth, but they said something like a movie thing or more basketball availability or whatever. So I'm hoping that you would make sure to do that, because I want to know the how. It's great to do a study. It's great to have something that you can work off of and hire people, but it's the how. How are you going to get in there? How are you going to do it? It's most important to me. Thank you.
appreciate it. Can I respond just for a second? Sure, thanks. So through you, Madam Chair. So we've spoken to some youth drop-in centers as well. We're meeting with the directors and superintendents of the school board this week to talk about surveys. We want to make sure we're not trying to duplicate any surveys or anything out there. It's really about alignment because we have the same goals. We want our youth to thrive. That helps our recreation department when they have, users of their services and they have, it's well utilized, not underutilized. It helps our faith community. It helps our healthcare agencies down the road. Like, it's really a big picture approach. As far as the how it gets implemented, the Planet Youth approach, it's not prescriptive, but there are examples from other communities where they've done things like subsidized recreational or extracurricular activities, and it could be sports, it could be theater, it could be woodworking, it could be whatever the youth identify as this is something we would like to do. So other places it's been engaging with the parents to talk about the importance of sleep and amount of time on devices and quality eating or having dinner with your family. So it's really looking at all the different domains and working with the young people to come up with tailored approaches and interventions. So, yeah. Sorry, thanks.
Thank you for that. Councillor Duthie, you had a comment or a question?
Thank you, Madam Chair. Through you, Madam Chair. So we have, we spoken to some youth drop-in centers as well. We're meeting with the directors and superintendents of the school board this week to talk about surveys. We want to make sure we're not trying to duplicate any surveys or anything out there. It's really about alignment because we have the same goals. We want to make sure we're not
Thank you, Madam Chair, and through you. Thanks for the presentation. I'm overall really interested in this. I do have a few questions, and some things have been mentioned here that sort of you've got my wheels spinning a little bit. But are other public health units, I'll just start at the beginning, implementing this in Ontario?
So through the chair to committee member Duthie, there are a number, I believe it's 5 or 6 health units that are also doing this across the province. We were the only one that got selected for this grant, but there were a couple that have already started this work, and there are others that are in the process of starting as well. Along with other agencies, there are some cities like United Way does it, some youth centers in Mississauga do it. So there are a number of sites, different organizations that take this approach. Yeah.
I'm wondering about the implementation in smaller communities, and sort of you referenced some different community groups and stuff that are trying to put it on as well. Obviously, Iceland, different setup altogether. It's sort of at a more national level as opposed to at the local level. And I'm just curious, what can be done, or what examples can we take from what they did there to implement at the local level specifically?
Yeah, so we do, through the chair and to committee member Duthie, we hesitate, and Iceland hesitates to say what worked in Iceland will work in Haldeman and Norfolk. They really want each community to identify their own activities and assets and interventions. Most of the other health units that are doing this work are actually northern ones, so up Temiskaming area, Porcupine Health Unit, Lanark County near Ottawa, Southwest Public Health is working on this as well. So they can be things like offering opportunities to have some subsidized recreation activities, or having, like I said, parent kind of engagement training. And in Iceland, they did things like an actual social contract where parents unofficially agreed with each other that our youth are important. We are going to commit to knowing where they are after 10 p.m. at night, and we are going to try to spend more quality time with our families. So going through parent councils or different ways to engage parent that way, just to educate them about the impact that some of these protective and risk factors can have on a young person's risk of using substances. That would be kind of one approach, but again, it depends what the survey results show are our local priorities and which partners are at the table and what assets and what they can bring.
Thank you. So you referenced it. I'm a little curious. So is there research then that shows like organized sports, theater groups, things like that, typically lend to youth being less inclined to use substance?
Through the chair to committee member Duthie, there are, as part of the survey, they do kind of correlation between the different answers and responses, and there has been research that shows, the more involved they are in extracurriculars, if they're engaged 3 or 4 times a week, that corresponds with a decrease in substance use. And I don't have the number offhand right here, I apologize, but it was quite substantial. So having those positive adult relationships, being engaged in something organized, productive with their time, that was correlated with a lower risk and lower use of substance use.
Interesting. I appreciate that comment, Josh. It's interesting. I think you said something about, trying to encourage dinner with family and things like that. And as someone with young kids, obviously we are very busy, and it becomes difficult to do that because you're rushing around to various different sports and things like that. So it seems really difficult to achieve. And then I think about the situation that we have with recreation, specifically in Norfolk County, where we have access issues for primetime ice and things like that. It's hard to facilitate that when you don't have that availability. Just my own observation. The grant, has it been primarily used for administration? Do we have money set aside to actually implement some of these action items?
So
I know you referenced a second stream, but that's not until 2025. So how are we going to be able to afford to do some of these things?
Yeah. So through the committee chair to committee member Duthie. So this grant, specifically from the Public Health Agency of Canada, was earmarked for just that community development and engagement, those first initial steps. So this funding was not intended to be used for actual interventions. So those discussions would have to be had, if we are successful in getting that second stream of funding, then that would be used for the implementation. Otherwise, there would be discussions with community partners. We've had some approach us already saying, we buy into this, we see the need, and we would have some funds. If you approach us once we're at that stage where we have the data and we're ready to roll out an intervention. Otherwise, we would be looking, internally to find some dollars within the health unit, I would hope. I don't have the authority to do that. I would have to ask but that would be my advocacy ask. This is a priority, and it's a long-term approach, so it really is taking the time to build up that community coalition and get the buy-in across all the different partners and sectors so that they can understand the benefits that this has for all aspects of our community.
I think it's important, however, I guess if Michael was sitting there, he's probably shaking his head going, there's no money right now. I appreciate this. What is the next step then? So obviously you're putting some things together. When could we actually see some of these action items, taking place? What's the timeline look like?
So through the chair to committee member Duthie, we are meeting with the school board later this week, and as far as the data collection, which is one of the first steps, is to get that information that you use to work on. We are really we were hopeful to let them dictate when it suits them best in their education cycle. If data collection in the fall or the spring suits them better, and then as soon as we have that report, we would, get that coalition activated and do those interventions. So it could be as soon as, it might be spring of 2025, it might be fall of 2025 before an intervention is actually implemented. But that would also align with that Stream 2 funding timeline as well.
Okay. I appreciate that. And then my final comment would be, we see this happen often where these coalitions and bodies get together and they do a lot of talk, but there's very little action. And I guess that's my closing comment would be, this is very necessary. I think we're going in the right direction, but there absolutely needs to be action. It can't just be a group of people sitting around talking. We need to actually do something about it because it is too great of a risk. I think you identified that in your presentation already. Some of the stats that we're seeing in Ontario are scary, and I can only imagine what it would actually look like here in Norfolk County as well, and Haldeman too. So it needs to actually happen. So I applaud you for applying for the grant and taking the step and going in that direction. Let's make it happen.
Thank you.
Echo those words, except it takes time. It took generations to get us into this mess, and we had federal and provincial mandates that made everything more accessible for youth, unfortunately. And now we are stuck with a problem, and the problem isn't going to erase itself in the next month or so with the Planet Youth program. It's going to take years of implementation to change the habits of our young folks, unfortunately. And I see it daily where somebody's OD'd in our community. Some young members picked up a pill and it's laced with fentanyl, and it's heartbreaking. And it's going to take years to get out of this mess that we're in, that's for sure. But we appreciate the efforts. Is there any further questions or concerns? Seeing none, may I have a motion to accept the recommendations found within the report, please? Thank you, Councillor Duthie. Seconded by Councillor Metcalf. All in favor? It's carried. Thank you. Moving on to social services and housing. It's 5.2.1. What do you want me to do, Dr. Locke, first? Would you like to? Dr. Locke would like to speak on a public health update before we move on to the other reports then. Thank you, Dr. Locke.
Yeah, thank you, Madam Chair. There have been a few events that have occurred over the summer which I thought the committee might like to be updated on and aware of. Certainly, we're now entering the phase of respiratory illnesses coming through. This year, I think it's going to be a little bit different because we have three concerns that are going to be culminating together. The first is COVID, of course, which is here and is now not considered to be seasonal, but there all the year round. Secondly, we've got influenza coming through. We don't know the exact strain that's coming through at this point, but we're keeping a close eye on a mutant strain that's coming through from the United States and around the world of avian flu, which is the H5N1 variety. This is a little bit of a concern if we notice that this mutates to become human-to-human transmitted. At the moment, there are large outbreaks in cattle in the United States, and if there's a mutation then between cattle to human, and there's been one case recorded down there, but they're not completely sure of how this was contracted. So we're keeping a close eye on that. And the third thing is the respiratory syncytial virus, RSV, that you may have been aware of, that's got quite a bit of media attention recently from the government. And all of these things, of course, put high-risk people in the population and community at risk. That would be the very young babies and infants, people that are immunocompromised, and the elderly. So we're keeping an eye on that. These three things could occur simultaneously, so that could be quite a considerable threat down the line if we see an increase in overall respiratory activity. We've had also a local case of rabies, which we haven't seen for many years. This was a young boy that was bitten, we think, by a bat. This is the first case that we've had in Ontario for many years. But it does show that, that this is still present, it's still around, and that people need to be very careful if they come into contact with these types of animals, really. Most cases that we've had in Canada have all been fatal, and we're still waiting to see what the outcome. This young fellow is still, I believe, in intensive care, and we're waiting to see what the outcome is there. Hopefully he will survive, but it's a significant issue. The other thing is that the incidence of this virus in bats has also increased this year. Previous years it's been 3-5% in that sort of range, but this year we're up to 16% of the bats that have been tested for rabies have been positive. So it's all over Ontario. We can't just look at where this actual event took place because it's widespread across the province. So we're keeping a close eye on that. Third thing is Eastern equine encephalitis, which is another virus that's mainly spread by birds and mosquitoes. And again, there's been one case in Ottawa this year, a human case, again, which is somewhat unusual. The name, of course, implies that this only occurs in horses, and it's not. Horses are one reservoir and can be infected, but the usual transmission is from mosquitoes. The third thing is that because of global warming now, they're noticing an increase in dengue fever, which is also a significant problem in countries where this is endemic, mainly South America and the tropical areas. Again, it's a mosquito-spread disease, and we don't have any vaccine or anything for it. That's sort of a summary of some of the recent activity here, but my message coming across from this is that where there are vaccines available for these, the population and the average person should consider perhaps getting protection by getting vaccinated against the ones that we have vaccine for. Some of these, as I say, we will be looking at our regular, usually H3N1 type of influenza that comes through, but we don't know the exact strain yet. We usually look for vaccine propagation for these particular strains. We look to Australia because their respiratory season precedes ours, and we usually take a look and see what is the dominant strain there before we can produce our vaccines for the strains that will circulate here. Unfortunately, it's a bit of a guessing game because this virus, also influenza virus, as it moves across Europe from Australia to here, can also mutate to strains that would be a mismatch to vaccines that we eventually choose. But I think it's very important that for the illnesses that we have vaccines for, that we should be further encouraging those people that wish to take the vaccine to get some sort of protection, because antivirals are only used after infection, and they're not really much use for prevention. That's all I have, Madam Chair.
Thank you very much for that update, and I appreciate, I know the summertime it was a little concerning with the rabies and such, so I appreciate you bringing that forward. We have questions or concerns? Councillor Van Riesche?
Thank you, Madam Chair, and through you. A couple of questions. Influenza, the vaccines aren't out yet. Probably, I don't know, when do you think they would come out? I think, what, mid-October or something like that, that they should be starting to come available for those who want to take it?
Through you, Madam Chair. Yes, that's the latest information that we have from the Ministry, that this vaccine is going to be available by mid-October.
Mid-October. The second question I have is about COVID. There was a lot of COVID around. I was on a cruise and acquired it after the cruise, but I didn't know I got it on the cruise. But so once you've had COVID, how long before you can get a COVID shot? Or can you get it? I don't know the rules on COVID, so.
Well, again, the COVID virus is mutating all the time, and there's a new strain coming through. So the government are still, or the ministry is still deciding. The vaccines come from Health Canada, and they come to the province, and then they're distributed by the province. But at this point in time, there's two new strains coming through, and we don't have that vaccine yet. The latest I've heard again is October. These, both the COVID and influenza vaccine can be administered at the same time. So when we get those vaccines, we'll be, from a health unit perspective, we'll be trying to put them in as many arms as we can. Yeah.
Just one further, the point about if you've had COVID, is there not a timeline you're supposed to wait until you get a shot? I thought it was 3 months.
Previously, it's been a 6-month hiatus between one vaccine and the next, but that may change with the new strains coming through.
Thank you. Any further questions, concerns? With that, I ask for a mover and a seconder to accept the recommendations from Dr. Locke. Councillor Van Riesche moved it, seconded. Councillor Metcalf, thank you. All in favor? That's carried. Thank you. Moving on to the 5.2.1 10-year housing and homelessness plan, year 9, HSS 24041. Stephanie. Where's Stephanie? Behind me. Thank you, Stephanie.
Hello, I'm
Madam
here.
Chair,
Thank
I
you.
apologize. Stephanie, can I just interrupt for one second?
Sure.
Councillor Duthie had to drop off. We still do have quorum, so we can continue. I just wanted to let you know
Okay,
he
I
was
wondered.
attending
I was
another
looking
meeting.
at the screen, but I thought sometimes it doesn't show everybody. Thank you.
Thank you for that. With that, through you, Madam Chair, I'd like to introduce Jessica Horton, our Program Manager of Housing Services, who is here with me today to present this report.
Thank you. Through the chair to committee, I will be presenting report HSS-24-037. The recommendation of this report is that it be received as information and that staff be directed to forward the 10-year Housing and Homelessness Plan Year 9 report to the ministry and post it on the division website. As the committee is aware, each municipality is required to have a 10-year housing and homelessness plan that outlines the community needs for housing and homeless prevention and strategies. The plan also outlines the actions we plan to take over the 10-year period. It is our guiding document on how we apply for funding and is the roadmap we use to make those decisions. The province requires that we do this work. When we submit investment plans, we have to link it back to this document. We are required to report on our updates every year to the ministry. We work with the building departments in both Haldimand and Norfolk counties to identify how many units and the types of units that were created. Some highlights from this year's work is that we supported 206 households with either a housing allowance or through the Canadian Ontario Housing Benefit, also referred to as COB. And there were also 83 households moved into permanent and or long-term housing. With that, I will open it up to any questions or comments. Thank you.
Any questions or comments? No, excuse me, Councillor Van Riesche.
So I'd like to ask a general question, therefore. How are we doing? Because I feel there's still a lot of people in need. And so therefore, could you describe to me where we're lacking and how we can, I know we're limited, but what can be done?
Hi, I'd like to take that question through the chair to Councillor Van Riesche. May I ask that we go through the next report and presentation, which talks specifically about some of the gaps in services, and I think will give us a little bit more content, and then I'd be happy to follow up and answer that question a little bit more fulsomely afterwards, if that's amenable. Thank you.
Thank you. Any further questions or comments? Seeing none, thank you again for the report. It's quite an important one, that's for sure. So with that, I call for a mover and a seconder, please, to accept presentation. Moved by Councillor O'Neill, thank you. Seconded by Councillor Van Riesche, all in favor? That's carried. Thank you. Moving on to 5.2.2 Housing Services Review, HSS 24043. The report is being introduced by Stephanie again.
Thank you. Through the chair to members of the committee, once again, Jessica Horton, our program manager of Housing Services, will start with the report, and then on the call with us on the meeting today is Dr. Alina Turner from Help Seeker, who will be presenting the presentation. Jessica, myself, and Dr. Alina Turner will be happy to take questions after the report and the presentation are completed. Thank you.
Thank you. Through the chair to committee, I will be presenting report HSS-24-043. The recommendation of this report is that it be received for information. Help Seeker Technologies was Help Seeker Technologies was commissioned as an expert in the field to review housing services and the end of operating agreements for all nonprofit housing providers. The attached report provides an in-depth analysis of our nonprofit housing providers. It looks at considerations for the potential amalgamation of providers and identifies strategies for ongoing investment and expansion of housing resources and support services. Help Seeker also reviewed internal capacity and program guidelines to ensure alignment with our current provincial funding envelope, which is the Canada-Ontario Community Housing Initiative, known as COCHI, and the Ontario Priorities Housing Initiative, known as OFI. I'll provide some background on why this review is needed. The Housing Services Act is the legislation that governs the work being done in housing services. In 2022, there was an amendment made to the Housing Services Act outlining a new service agreement framework for Ontario's community housing sector. This relates to the end of operating agreement and end of mortgage operating provisions in the Act. This new legislation enables service managers and housing providers to enter into new operating agreements that address the local housing needs and conditions. As we move forward with the municipal model of community housing, consolidated municipal service managers are now permitted more autonomy to create new operating agreements as agreements and mortgages come to an end. There is still provincial legislation in place that these new agreements must adhere to. This report will guide system management and housing services and the community housing system in future planning. This information will be used to update our housing and homelessness plan as we are entering year 10 of that plan. As the report outlines, those in core housing need continues to increase, and proactive planning is required to address this as time goes on. And now I will turn it over to Dr. Alina Turner from Help Seeker to give a presentation on the findings of this report. Thank you.
Hi everyone, just checking my mic's okay. Looks like I'm getting some nods and thumbs up, awesome. Thanks everyone for having me today. I'm joining you from all the way out in Calgary, and good news, our water main has been fixed and I was able to shower finally after 2 months.
Wow.
If anybody's been keeping track of that, you know, municipal infrastructure challenges at their best, so to speak, but it's not about Calgary, it's about your community, and we were privileged to work with your team over the last several months to do an in-depth review on the housing system specifically. So you have been circulated a hefty report, but of course that's oftentimes not the best way to kick off a conversation, which is what we're hoping to have with you today. So what I did is choose a couple of the juicier insights and kind of give you the highlights, so to speak. And of course, you would have had the privilege of reading through the entire report if there's additional items you want to chat about. A note, if somebody's wondering why is a technology company with a focus on complex social issues doing this work for you, and that's primarily because your team was looking at future incorporations of artificial intelligence and digitizations to really streamline their own internal operations. And that's, again, a kudos to the team for looking at how to maximize taxpayer dollars as we do this type of work. So what you're going to be presented is about more traditional analysis, but what we did in the background is also work with the team on what aspects can be automated into the future, where can we see potential for enhancing data collection and data real-time decision making as well. So I'll try my best to highlight those as well because they're more in the background of the report, but the important part for today is really to look at this analysis of the social housing system. So it gives you guys some insights and recommendations on the evolving needs of the community as well. So scope of the review, we looked at the entire programming operated by HNHSS for social housing. So everything from the Housing Stability Bank all the way to rent supplements and everything in between. The housing landscape being under pressure is nothing new, and just listening to your comments and reviewing some of the remarks in the media by some of the councillors in the past several years shows us that the social safety net is definitely under pressure in both counties. And not surprisingly, when we looked at the RGI units, the rent geared to income, the current supply being 594, if you don't have that number off the top of your head, there's about 433 households on the wait list. And you know, of course, that one household is multiple community members. So it's a significant amount of folks that are in need and have unmet need. Now, the other thing that we also did is spin up, what would this look like using some of just basic projections, nothing super fancy at this point. But by 2031, we'd be looking at over 3,655 individuals. Again, individuals, not households. Okay, we might be able to put people together and share units and such. But that number suggests that there's a considerable number of folks that are going to require housing support, which is, again, an increase from the current unmet need. So why? Because the community is still continuing to grow. And the other reason is, of course, because the housing pressures, inflation, the post-COVID stress on households, and you heard folks talk about the mental health and adverse childhood experiences. These are all layered challenges that compound to increase risk for housing instability and the unfortunate extreme of that, which is homelessness and encampments as well. So the questions we sought to answer is, what housing support types do we need? How much of each type of housing are we going to need? And how do we build this capacity as a system? So of course, what do we have, right? And so this is just a snapshot of the current portfolio of nonprofit units and RGI bedrooms. So you can see nonprofit, we have 284 in total, and you can also see by bedroom types, primarily in that one bedroom, even though of course we've got families that would require multi-bedroom units, but it is what it is. And so in terms of bedrooms, we have a total of 891 bedrooms as well, and in those 594 units. Now, when it comes to what do we need, and as you can see in there, we look specifically across all these portfolio components. So in RGI, the number of folks that were currently being helped, 1296. The Housing Stability Bank was looking at about 750. Housing allowances were about 90. Ontario Renovate's about 100. So served today, we are looking at 2,200 and some. But when we looked at what we might need into the 2031, we've got about 1349 that is a deficit. So we said, hey, if we spun this up and we actually created all these new units, would be able to kind of balance the books. And so we did our modeling, and the reason you see that -3 is because in our model we said, hey, we balance the books, right? It's never a perfect calculation, because if you go one over or one less, it's kind of, the math doesn't quite always add up to net zero, but gives you an idea of what's needed. So we would essentially need to go from helping 2,200 to helping about 3,600 folks, to give you an idea of what it would take to keep up with demand. Now, of course, it also matters what right sizing of the supports entails. And of course, that comes down to resources and cash, of course. And we're not saying that this money is in the bank right now. We're saying this is what it would take to make this happen. So to get to that almost net zero, that -3, meeting people's needs type of calculation, we would be looking at a considerable additional cost. And of course, we would need to tap our federal and provincial counterparts for affordable housing. That is definitely not the pitch here, is to increase taxes for the common man in the local area. This is really an all government, all out response that's required. And so, of course, we know about the National Housing Strategy. We know about the Ontario investments happening across the province, and it's just a signal that we need to do our part in terms of advocacy for Haldimand and Norfolk as well, because there's a significant need, and the numbers are considerable. Who needs support? We did take a deeper look in terms of projected number of individuals by specific key populations. You might come back and say, hey, I'm really, really interested in this demographic as well. We can definitely do that too. But the team's focus here was, in general, what are we looking at? Let's take a deeper look at seniors. Let's take a deeper look at that younger population. Let's take a look at Indigenous population. And you can see in there, based again on current demographic and projected demographics, we'd be looking at quite a few of those units being senior units out of that general 3655 that's being needed by 2031. And of course, the Indigenous being lower, of course, simply because it's a smaller proportion of the population, but still a notable one as well. And about 720 in terms of youth. We try to spread it out across those program types so that we're looking at renovations at the same time as looking at RGI, at the same time as looking at stability, Housing Stability Bank and allowances, to try to take advantage of some of the market solutions as well, and fully considering that building is expensive. And so by looking at a mix of programming, we feel it's a smarter approach. But of course, that portfolio might change if a massive infusion of capital dollars comes in specific for, let's say, special care facilities, etc. On note on the end of operating agreement, so this approaching expiration, and I think Jessica did a perfect job explaining the risk that we've got hundreds of these RGI units that are going to come to expiration between now and 2031. And it's a challenge, but as every challenge, it's every crisis is an opportunity. The opportunity is to reimagine the affordable housing strategy as well. So as the compliant periods for these agreements come to an end, there's this need to address consequences as well. So there's some risks to these loss of these agreements, and that might be just simply that these units disappear from the non-market universe. There's market sensitivity, there's sustainability issues, there's accessibility issues. Some of the units, not all units are equally accessible, and not all units and buildings are sustainable financially either. And the report digs into some of those details as well. We did a bit of a deeper dive on the operating agreements as well. And again, just taking a look at the mortgage maturities and some of the notes that there are some of the properties where we do have some considerations when it comes to financial feasibility. And those, again, we can get into depth here, or rather, and what we propose is that there's a deeper dive done by administration on kind of one at a time, because again, the one thing that is really important to note here is the type of data that was available to us in the review left a few gaps that need to be filled. So that is made then it is made clear in the report as well. So here's what you've got in terms of soon expiring agreements. Again, just giving you a sense of kind of a snapshot of all of this, if you might have not seen this before in one shot. And then here's the updated operating agreements. So Kimbilla, Linview Terrace, Robertdale Court, etc. You can see kind of a breakdown by features, by unit types, etc. And same here too for the soon expiring agreements. In terms of recommendations from our end, after having spent the time on this, the expansion and diversification of housing options. So how we go about accessing additional dollars to support this operation expansion, how we enhance operational and financial efficiency. So how can HSS strengthen the long-term sustainability of these housing providers? I think to us, the department has capacity and has strategic foresight in terms of performance measurement and management, and they have a keen interest and ability to look at data in terms of systems planning. However, what's of interest to us, and I will say it as again a tech company that is disrupting consulting world, we see a lot of things that were tasked to us as the external contractors that could have been done in-house just as easily. But for various reasons that it's, again, not beyond our pay grade, were contracted out. And again, when you contract out and you don't build that internal capacity, you become reliant on contractors all the time. Our business is to go in, figure this stuff out, and then leave AI or technology behind to do the job to enhance the human capabilities. And we saw a lot of human capability. We didn't see a lot of kind of data and technology capability. And then we saw an over-reliance on consulting on some of these things. Now, it's not, again, I don't think it's even the department's decision what gets contracted out to consultants and what gets done in-house. But there was nothing that gave us the impression that some of this work couldn't have been done in-house. So I wouldn't be an earnest business owner to not disclose that as also a taxpayer. Having said that, there are some policy and governance models that could be enhanced, specifically around the data-driven work that the funded organizations, the nonprofit service providers, there was a lot of data that was being collected in a very old school way. And we have new technologies that are much more efficient at getting the team real-time data to make decisions and bring better data to all of you for timelier decision-making as well. So some of the things that we saw missing were specifically around how clients move through the system. So how are these various kind of portfolios integrated? Because we also have an eye towards homelessness, that's another area of expertise for us. We could see that these wait lists probably have a lot of overlap. There's probably a lot of overlap with some of the other programs as well that we talked about today, like the youth and children's programs. All of these should be integrated. And again, it's not necessarily the department's decision, but I would say I just came back from a policing conference at the Safety of Our Cities in Peel Region, where encampments were the #1 issue, and that was my kind of keynote address, was focusing on bringing technology in to help bring the entire safety net together, housing being a component, but your community safety and well-being plan being another component, your early intervention years and childcare programming being another one, maintaining privacy, but enhancing that data-driven decision-making in an integrated fashion. That's where enhanced policy and governance could be really, really enhanced from our perspective. And so obviously, leveraging data and technology is not going to be a surprise to see that across the entire report as a theme. We saw that as a kind of a missing layer in the department, and it's just simply that probably because they've been, I mean, just looking at the Kawartha, for instance, they have full-time data analysts. Like there's a bigger kind of component in an equivalent sized municipality where they have done more of this data work internally, and where they kick out the consultants and they build their own capacity, which I think is a smart move. Maybe not for the typical consultants, but because we are more on the tech side, I can be honest about it. And so with that being said, building that organizational capacity, you have people that know what they're doing. You have people that are committed and have all the information we ever requested. Unfortunately, on Excel spreadsheets, not on high-tech kind of tools. But having said that, there's no reason with a little bit of capacity building, some enhanced support from council, that they can't take this to the next level as well, which is exactly what you're going to need if these operations agreements are coming to an end and you need to build a whole new way of doing business. And you might be looking at really complex deals around mergers and acquisitions. You might be looking at the potential dissolutions of unfeasible projects or divestments. That's going to require some deal makers that are able to be on the team as well. So I'll pause there, and I look forward to your questions.
Thank you very much for your report. It was quite thorough for a tech company, I'd say. And I know Haldeman County, we're looking at how we can bring more digital services and incorporate that, so we're not sort of keeping up with the world around us. So it's nice to hear you say that Haldeman and Norfolk needs to get moving and get on board with more tech services, more digitalization. So thank you for that. Is there any questions, concerns? Councillor Van Riesche?
Thank you very much, and through you, my apologies. My computers weren't working on the weekend, didn't get an opportunity. And where I live, you cannot download anything this size. So at the end of the day, I was at a loss. I want to go back to my questions, and if I could see them maybe taking a look at. And thanks for telling me, as a consultant, I have to be really candid here. Thank you for your honesty in telling us that maybe we should kick out the consultants and do things in-house. I thought that was a great statement, so thank you very much.
You're welcome. I can only say that because my company's job is to do that, to automate the things that are, doable by artificial intelligence, so that we can, shore up your guys' teams, right? Your teams are the local experts. And so when consultants come in, they extract and they leave, right? So and I saw it when the team shared with us all their reports over the years, like, why are we doing, like, what's happening here? This is unusual. So anyways, it would be awkward not to tell you. Think twice before you commission things out, especially, I mean, we did as you can see, we did a thorough job, but we also could have, if there was a staff member that could have been kind of more dedicated to this, we probably could have done it in quarter of the cost, and you could have had an FTE, right? Because we could have used our AI and our technology to shore up one of your staff members, and you would have been one FTE ahead. That could have done other things as well.
Again, thank you very much for your candor, and I think that's been taken under advisement here, that we're going to take a serious look at more and better data collection. Thank you.
You have another question?
No, if there's questions that they could be answered, I had proposed.
Oh, sure. Okay, go ahead. Sorry about that.
Thank you, through the chair, to the members of the committee and Councillor Vanderdrishi. I'm going to also pass it over to Jessica to add some detail, but I did want to start with that revelation that's not a revelation for us, that better in-house capacity to do the data and do some of the work beyond the capacity of the folks that we have. So I just wanted to say something. We recognize that. I think technology would be a welcome assistant to us in a lot of our work. The work of the team is growing every day. They are extremely busy, so it's not about that we don't have, basically I'll say it this way, we don't have the internal capacity to do the work that we've hired somebody to do, and I do agree that we need to look at that in the future and how we can use opportunities for if there's other funding available, other ways to invest in the team to allow them to do work and have somebody do data and so on. So I just wanted to say really clearly that the work of the team does continue to grow and that we recognize that too. So I'd love to see us take this under consideration, and opportunities and ways that we might be able to leverage additional FTEs would be fascinating and fantastic for us, or technology opportunities and so on and so forth. So I just wanted to say, yes, I agree, but I did want to make it really clear that the reason that we commissioned this work is because we simply do not have the internal capacity to do it right now, but that I would like to see us in a position in the near future to be able to do that. So I just wanted to note that before I asked Jess to add in some comments on the broader scale of the report and the work that we're doing. Thank you.
Thank you. Through the chair to Councillor Vandendrishi, I can speak to the number of households that are currently on the wait list for community housing. So I know in Alina's presentation, I think she noted it was 400, and off the top of my head, I forget. But I can tell you that as of last week, that number is now 534 households on the wait list for community housing. I can also tell you that on the by name list, there are 105 approximately households on that list as well. So that speaks to the growing need in the community for affordable housing solutions. Thank you.
Thank you. Go ahead, Councillor Vanderdrishi.
How do you qualify for the list? Like, what is the criteria? Oh God, I hate that when you're behind me and I can't see you. But anyway, how do you qualify? What is the criteria that's made on the list when you have your interview with these families or individuals? What is the criteria that puts them on the list?
Through the chair to Councillor Vandendrishi, so individuals can apply for the rent geared to income housing waitlist online or through a paper application. So anybody living in Ontario can be applying to community housing in Haldeman or Norfolk. So we're looking at they have to be under the income threshold, which is set by the provincial government for each municipality. Off the top of my head, I don't have what the income threshold is currently, but I can get that and bring it back if you would like it. We are looking at individuals' assets, if they own a home, and what their family makeup is for each unit, so, or for each household, to see what units they would be eligible for. Thank you.
Can I continue? You talked about if they hold assets. If they have a house, why would they need one?
Through the chair to the counselor. So individuals can apply to the rent geared to income list if they have a home, but then if they become eligible and can move into housing, so say their income has changed and they're having trouble affording their home, that would be an example. They have to dispose of their home within a certain amount of time before then they would be eligible to move into a rent geared to income unit.
Is there anything else? Any other criteria that would allow you, other than just your income? Like, at the moment, you have no place to live. Is there a list of?
Through the chair to Councillor Vanden Drieschie, so there are special priorities that individuals may have. So for example, an individual who is a victim of domestic violence, or individuals who are victims of trafficking, human trafficking, they would be the priority at on the centralized wait list.
Okay, if I could get a copy of that list, that would be great. Thank you.
Thank you.
Thank you. Is there any further comments or questions? Seeing none, may I have a motion to accept the recommendations found within the report? Thank you, Councillor Metcalf. Seconded by Councillor O'Neill. All in favor? And that's carried. Thank you. Thank you very much for the report. We'll move on to, you have another one, never mind. Yeah. 5.2.3 Licensed Home Child Care Agency Services Agreement Extension, HSS 24046. Stephanie, you're ready?
Yes, I am. Thank you very much. Just took a minute to swap seats here so that we could bring forward the program manager. Through the chair to the members of committee, I am happy to introduce Jen Snell, who will be presenting this report to you. Jen is one of our program managers for our children's services programming.
Thank you and good morning. Through the chair to the members of the committee, I'm happy to be here to speak to report HSS-24-046 Licensed Home Child Care Agency Service Agreement Extension. To provide some context to this report, I'd like to highlight the timeline from the previous council report to where we are today. When I presented to advisory in the spring of 2023, we were seeking approval for a single source service agreement with Today's Family, our existing licensed home child care agency, for a period of 18 months. The intent at the time was to allow for the implementation of the Ministry of Education's new child care funding formula in January of 2024. With time given to become familiar with the new approach and proceed with a request for proposal to secure a long-term service agreement by the end of October 2024. The Ministry of Education has delayed the implementation of the new funding formula by a full year, with a new and confirmed implementation date of January 1st, 2025. Now that the funding formula has been released, upon review, I can say for certain that this will be a transformational change for the childcare sector, childcare operators, and service system managers across the province. The formula is quite complex and will require some time to build familiarity, work through a full year cycle of calculating funding allocations for the year, mid-year and year-end reconciliations, audits, etc. The full cycle, including reconciliation and reporting to the ministry, will take us into at least the second quarter of 2026. Seeking a 2-year extension to the existing service agreement will provide us the time necessary to complete one full funding cycle and reconciliation process, identify and work through issues, and make any required adjustments moving forward for the following cycle. A 2-year timeframe will also provide the additional time to work through the procurement process in alignment with our purchasing policy to secure a long-term service agreement for the fall of 2026. Beyond the time needed to work through implementation of the new funding formula, a 2-year extension will offer stability and continuity to children, families, and home child care providers as we move through this transformational change within the child care sector. I'm thrilled to report that we have seen a great deal of growth in licensed home child care over the past year, with 7 new providers on board, their homes opened up for care in communities across the 2 counties we serve. Currently, we have 14 active homes with an additional 6 providers working through the process of contracting with Today's Family. At such a tumultuous time of change, there is great benefit in maintaining stability and support for providers, as well as continuing with the current momentum of growth and recruitment. A 2-year extension to the existing service agreement would support this continued path of expansion, provide stability to the childcare system through this significant change, as well as allowing Children's Services the necessary time to implement the new funding formula and complete a full year cycle of funding and reconciliation within the new model, better positioning us to move forward with an RFP in the latter half of 2026. I'm happy to take any questions.
Thank you. Councillor Van Rishi has a question.
Thank you very much. I'm quite familiar with daycare, and I'm so pleased that these new changes are coming about. We were going to lose daycare. It was just unfeasible for those operations to operate with the funds that they had. So the new changes and the new formula, I think, is welcomed by many of the daycare organizations. Because it's going to be more intense to be able to do the paperwork that's involved, are daycares allowed to put in their operational budget that of someone, someone that would be able to do those? Because a lot of the administration doesn't necessarily have someone that can take the time to do all the paperwork that's involved. Can that be a cost that can be allocated to the new formula?
Through the chair to Councillor Van Rishi. The new funding formula is very, very different from the current funding approach that's in place right now. We're still working through many kind of early stages of this, but it's broken out into separate components of the funding. We believe that it'll give operators greater flexibility, and from what I can see, there will be room for those kind of administrative costs certainly built into the funding available to operators.
That's good to hear, because I know a lot of the daycares that are operating are parent administrators that come in and they run the programs, and then they have daycare ECEs that are running the programs and the children. But I think there's a huge need to, because it's accountability, we want to know where every dollar is going, but we want to make sure the dollars are there for them to operate. With the new system of bringing it down to the $10 a day, I mean, a lot of these places couldn't operate. It wasn't even, they were going to lose out. And our next question is, you have 7 new homes that have come on board for daycare, correct?
Yes, through the chair.
That's good.
Councillor, yes.
That's good.
We've had 7 in the past year.
That's perfect. As well as, are there any organizations that are coming where they want to have a more organized group, like we have Sunbeam in Tillsonburg, we have the Langton Little People, or the Norfolk Little People. Is there more of those that could come on board? Have you seen interest in that?
Through the chair to Councillor. Are you referring to new operators being interested, or
Yes.
this report is specific to licensed home childcare, and we currently only have one agency that we're working with. That agency specifically works with licensed home providers. We have one licensed home visitor that works with those providers.
So this doesn't apply to the daycares that we have now? I guess I'll ask.
May I speak to that? The new funding formula applies to all licensed childcare that's enrolled in the Canada-wide early learning and childcare system. Right. So there is new funding for licensed childcare centers as well as licensed home childcare. This report is speaking to maintaining our existing agreement with the licensed home agency that oversees or works with licensed home providers in Haldeman and Norfolk.
So when will you come to us with those that are like the Norfolk Little People and others that are operating like that? Is that not part of this then? Okay, well, back over here.
Yes, through the chair to Councillor. So the new funding formula will roll out for all licensed childcare and licensed home in January of 2025. So the new funding formula applies to any of those licensed childcare operators that are already enrolled in the Canada-wide early learning and childcare system. So yes.
I still can't get a direct answer. Is Langton Little People considered part of this?
Through the chair, yes. Any current ongoing operator just continues to flow through this new funding model. So they will operate, right now they're operating with us. They have an operating agreement. We don't need to come back through for a new operating agreement because they've already signed a CWELC agreement. This is just an updated funding model for that. So operator A is with us today. They're under our current funding model, January 2025. They move into the new funding model, but they stay with us. They continue to operate. We're not at risk of losing them from the system. In terms of new operators, if they're not currently a CWELC operator, they can continue to apply. Applications for that are based on our directed growth plan and based on the funding that we have available to support additional spaces to a maximum that has been capped by the province. And so we're currently working through that plan. So if it helps, we're not at risk of losing anything we currently have. Because the licensed home childcare, we have an agreement that is ending. We're asking for direction permission to just extend that contract longer because that new funding formula,
it's going
we
to
need
take a
to
little
work through.
longer.
You've got it. And we're pleased with the work they're doing. We're satisfied. As Jen pointed out in the report, we have 7 new licensed home childcare providers. So things are very positive. So there's lots of good news there. We're comfortable and satisfied and hopeful that we can continue to work with them in that current agreement. And then at the end of that, should we be granted permission, 2-year extension, we would be coming forward for an RFP, which would open it up to the market according to our procurement process. So technically we're due to do that now. We're asking if we can just pretty please have an extension so that we don't have to do that right now and keep the provider in place to stabilize the licensed home childcare component of this system, reassuring that the rest of the system continues to maintain and that we will work with them. Just they'll have a new funding formula that we will work with them on, if that answers the question.
That helps me. At the end of the day, one of the many complaints I get out there is we don't have enough licensed daycare for the families that are moms and even dads wanting to go back to work. So, daycare is very, very important.
Yes.
Have you heard that? Have you heard that we need more, is, I guess, an easy question.
Yeah, through the chair to the councillor, yes, we absolutely have. I would say that our wait list speaks to that without us even having to have that conversation.
Absolutely.
And Jen can add some information if she'd like to, but certainly the need exceeds the supply. I will say that across the social services and housing sector, that is what we see in all of our programs and services and support. So absolutely, we hear it. We relay that information through the ministry, so they're well aware of the needs across the province and across Hallam and Norfolk. So we definitely do what we can with what we have. Could we use more?
Absolutely.
You bet we could. We sure could. Thank
Well,
you.
I'll advocate for that any day. Okay, thank you very much for the report, and hopefully moving forward, we can even open more. Thank you.
Any further comments or questions? See none, may I have a motion to accept the recommendations found within the report, please? Can I have a mover, please? Councillor Van Riesche, seconded. Councillor Metcalf. All in favor? This motion is carried. Thank you. We'll move on to communications. 6.1, September Alpha Info Break. May I have a motion to accept the item 6.1, September Alpha Info Break as information? Can I get a mover and a seconder, please? Moved by Councillor Metcalf, seconded by Councillor O'Neill. All in favor? And that's carried. Thank you. Under other business, I don't see any. The next meeting is Monday, October the 23rd, 2024. May I have a mover to adjourn this meeting at 11:25 a.m.? Moved by Councillor Metcalf, seconded Councillor Van Riesche. All in favor? This motion is carried. Thank you.